double chin without surgery. Sculpted jawlines have always been considered a hallmark of attractiveness, but with selfies and candid photos practically becoming a mandatory part of existence, most of us have developed a whole new level of fear of double chins. After all, photo retouching apps can easily banish any signs of dark circles, laugh lines, or crow's feet, but it takes seriously good Photoshop skills to make a doughy profile look sleek. There are 3 common causes for the appearance of double chins: excess fat, poor skin and muscle tone, and poor genetic luck. The good news is that there are effective ways on how to lose a double chin without surgery. 1. The most obvious cause of double chin is excess fat, which is why some people, even relatively thin people, can grow double chins. The fat cells in our body are like honeycomb structures that sit right under the skin layer. Normally, fat deposits first accumulate around the trunk. In women, it usually builds up around the hips and waist, while in men, it tends to gather around the waistline. Sometimes, however, the body gains so much fat that these fat cells overflow, so the fat needs to go somewhere else, such as on the underside of the face and around the neck. Before you know it, you have a rounder face, and each time you move your chin down, it emphasizes the few extra ounces of fat clinging to your jawbone like barnacles under a ship. In this case, burning off fat stores and achieving a healthy proportion of muscle to body fat is key. 2. In some cases, poor muscle tone, an inevitable effect of aging, is the culprit. Once you reach the mid-20s, your muscle fibers progressively start to break down, and unless you do something about it, they will continue to sag as you get older. To help firm up the facial muscles, you can do some exercises. For instance, the following move specifically targets the underside of your chin. As you sit with back straight and shoulders down, tilt your neck up toward the ceiling. In this position, open the upper and lower jaws as far apart as you can while still keeping the lips together. Hold this position for about 20 seconds, then repeat for a total of 20 times. 3. For even better results, combine Step 2 with a more aggressive skincare regimen. Aside from decreasing muscle tone, decreasing levels of collagen and elastin in the skin contribute to the appearance of a double chin. Taking daily collagen and vitamin C supplements can help, in addition to applying creams and moisturizers that contain anti-aging ingredients. Don't forget the neck area whenever you tone, cleanse, moisturize, and protect. Just like the skin on your face, your neck also needs TLC in order to look youthful and firm. 4. If your double chin is the unfortunate result of heredity, look to your parents for a clue. There's good news for you. The Food and Drug Administration has recently approved a procedure that uses fat-melting injections to reduce moderate to severe fat deposits under the skin. The procedure, which is being marketed under the name Kybella, uses direct injections of deoxycholic acid directly into the area. The acid eventually dissolves fat after multiple sessions. Bruising, pain, and swelling are common side effects, but they typically go away after 2 to 3 days. Kybella is only advised for patients who have fat deposits under the skin without any skin sagging. Otherwise, a follow-up neck lift is needed. It requires up to 50 microinjections per session, and you'll need anywhere from 2 to 6 monthly sessions. The results can last several years. Make sure that you get it done by a well-trained professional, because the use of wrong techniques can cause damage to the surrounding skin, nerves, and muscles. These tips on how to lose a double chin without surgery have been proven to be effective, but they do take some time for results to manifest. In the meantime, you might want to consider using contouring makeup techniques to achieve the look of a slimmer, firmer face.